everyone, my name is Messi Okafo. I am a Canadian RN currently practicing in Canada. I am a US RN and a certified nurse educator. I am the CEO of Trinity Nclex Academy. Today we'll be talking about antidiuretic hormone, like the disorders that have to do with it. Antidiuretic hormone is produced by the pituitary gland, the posterior pituitary gland. What does antidiuretic hormone mean? When you say ADH, it means anti means against. It's just like when you say anti-robbery squad, like the squad against robbery, right? So anti means something that is against. Then diuresis means like peeing. That's like the simple term for this word, like peeing. So diuresis is peeing. Then the H is the hormone. So it means what? The squad that is against what? Excessive urination. Clock it. Now, we're going to be talking about the diabetes insipidus, not mellitus, so that one has to do with pancreas. So we're going to be talking about diabetes insipidus, and we're going to be talking about SIADH. SIADH is the opposite of diabetic insipidus, which simply means syndrome of inappropriate antidiuretic hormone. Now let's go. So we're going to start with diabetes insipidus. It simply means that ADH is low. There's hyposecretion of ADH by the posterior pituitary gland. That is what it means. Remember, I told you ADH is antidiuretic hormone, the hormone against urination. Now, if it's low, like it is low, hyposecretion means it's not producing enough. So if it's low, what do you think happens? The patient keeps peeing a lot, like there's more diuresis. It means that it can no longer like function properly. So it's going to start what the individual will start peeing excessively. Now, if you pee too much, what do you think can happen to this individual? That is what we are going to be diving at in this topic. What can lead to diabetes insipidus? When you have like brain tumor, it can lead to it. When you have like trauma to the brain or brain injury, probably an accident that happen, or probably a surgery as well. When they do surgery in the brain, it could come as a complication of that surgery. So for this, we are going to be going into the signs and the symptoms. For assessment, I already told you that this patient is not producing enough ADH, which means that this individual cannot what? The body keeps releasing excessive fluid through urination. So what is that? What is that term? What is that term in nursing? That is what we call what? The polyuria. So when you pee too much, what do you think happens to the concentration of this pee? Will the concentration be high? Too much of pee. When you pee too much, is the concentration going to be high? No, it's not going to be high. The concentration is not going to be concentrated. It's going to bring about what? Dilute urination. Are we together? So when you get dilute urination, what happens to the specific gravity? We are kind of like these signs and symptoms are interrelated. So what happens to the specific gravity of this? Will it be high? Will it be low? Will it be high? You need to tell me that. It's going to be low. What is specific gravity? Is the measurement of the concentration in what? In the urine, right? So if the urine is not concentrated, the specific gravity will not be high. So when you check the specific gravity of this diluted urine that is coming from this patient, because this patient kept peeing and kept peeing and kept peeing, so for this, they're going to have like low specific gravity. What about dehydration? Don't you think they're going to get dehydrated? Of course, they will get dehydrated because they are losing all the fluid in their body. So there's going to be dehydration, there's going to be electrolyte imbalance. The body is going to be dried up. Like you're peeing excessive fluid out of your body. Even when you're trying to like take oral fluid, it might not be able to, it won't even be enough with the way the individual will be peeing. So the oral fluid might not even be enough to replenish the individual. I know you'll be extremely thirsty as well, because from the polyuria, you get dehydrated, you have what? You have polydipsia as well. So you start feeling so thirsty at this point in time. Then for that, the patient should be dehydrated, and the serum concentration of the body will become what? Will become concentrated, because here there's no hemodilution. Instead, you are what? You are removing fluid from the blood in the body. So because of this, the serum osmolality is usually what? High. Clock it. Because what? Because you are dehydrating, you are removing fluid. So when you remove fluid from the serum, it becomes concentrated, and because of that high concentration, that is what brings about the options that you're going to be seeing in your U-word. I hope you're doing your U-word or other let's not just talk about you alone. There's boot camp as well. So I hope you're doing that. So when you do something on diabetes insipidus, you can be seeing one of the options as, oh, what happens to the serum osmolality? So due to the concentration, there's high serum osmolality in this patient. That's another one. Then also we have what do you think we have what do you think will happen to the blood pressure of these patients? Have you noticed it that when you have a low blood pressure, like probably a patient is running into shock, what did you do? We do fluid resuscitation, right? Because there's no, like, this is just like to dilute the blood to lead to hemodilution and to be able to like raise up the blood pressure in the body. Now imagine this person is extremely dehydrated. What do you think this person is going to be leading into? It's going to be leading into what? Postural what? Hypotension. This kind of person cannot even change, like you can't even change position, like sitting or standing. You can't change position rapidly for this kind of individual. They can run into posterior hypotension. And also, when I told you that they get dried up, when you check their electrolyte imbalance, because they are kind of releasing a lot of fluid, they end up with hypernatremia. And due to hypernatremia, when you have sodium imbalance in the body, an individual is usually prone to seizure when you have like massive hypernatremia. When you have massive hypernatremia, you are prone to having what? Especially sodium imbalance, not just hypernatremia, even hyponatremia can lead you to seizure. But in this diabetes insipidus, the individual is going to be having what? Hypernatremia, because they are dehydrated. And for that hypernatremia that they're having, it's going to predispose this individual to having seizures. Are we together? So from there, you can have altered level of consciousness, you can have confusion, the person can become confused. So what does that tell you? In order to be a safe nurse, it means that you have to be checking the neurological status. You need to be doing neuro assessments as one of your focus assessments you'll be doing for this patient. So you need to be checking the focus assessment. So we have spoke about some signs and symptoms. We talk about excessive urination, that is polyuria. Because of polyuria, you are going to be dehydrated, which is going to lead to what? Polydipsia. Then, which other one did we talk about? We talk about the serum osmolality. Due to dehydration, the serum in the body is become what? The serum osmolality in the body, the serum becomes what? Concentrated, thereby leading to increase or high serum osmolality. Then we talk about the specific gravity of the urine of the patient, which is going to be low because the urine is what is diluted. So specific gravity is measuring the concentration. So obviously it's going to be low. Then we talk about the sodium imbalance, which is hypernatremia, that is going to predispose this patient to seizures, right? So for this, we have to like carry out like seizure precaution on the patient. So we are going to be talking about that in our intervention for diabetes insipidus. What else do we talk about? We talk about postural hypotension due to what? Due to excessive urination in this patient, which can run them into shock. As a smart nurse, you are supposed to know what you are supposed to do for intervention in this patient. So when you are dehydrated, what do? You definitely do fluid rehydration for this patient. And because this patient is prone to shock, you have to rehydrate them, like intravenous rehydration. IV fluid can be what administered to this patient. Then what else can you do? I talked about them having like being prone to seizures, right? Because of hypernatremia. Then you have to institute the seizure precaution for this patient. Something does not need to happen before you take action. So there are steps that you can do to prevent complication in case seizures happen, because someone that is actually like inactive sizzling, it can actually fall from the bed, right? So for this kind of patients, it's not as if you're not going to admit them on the floor. Even if somebody is having seizure on the floor, the person can still hit their head. So for that, you need to like clear the room and remove every unnecessary stuffs out of the room. So anything that is not relevant in the room, you want to remove it, because when seizure occur, like in case, but you are supposed to prevent falling. So in case falling, but definitely we are going to prevent falling, right? So another thing is that for the bed, it has to be in the lowest position, because just imagine mistakenly the person fell. Because if you have seizures, like if you have the tendency of going into seizures, you are a 4 risk patient. So in case this thing happen, the bed has to be in the lowest position to prevent the heights to which you are going to fall, right? So first of all, the bed is in the lowest position. The side rails are raised up. You need to like raise the side rate up. Why? So the side rate can prevent you from falling, obviously. And also the side rate has to be padded, because if the individual is like sizzling and hits their head, it can actually like injure their head. So you are going to be leading to another one like trauma or head injury again to the patient. So for that, you need to like pad the side raise of the patient and ensure that the suctioning machine at the bedside of the patient. In the room, there should be a suctioning machine. So most of the time, suctioning machine is usually attached to the wall. In every room of the patient, you usually have like there's a tubings that are attached to the wall, and the suctioning stuff is there. So your own as the nurse is just to ensure that the is working, and also the line that you are going to be using is actually working as well. And also, oxygen tank should be at the bedside of the patient. Oxygen tank is like, that's for like probably by the bedside of the patient. Oxygen tank, that one is like a, how would I put that now? So most of the time there's always like oxygen that is attached to the wall. Just the nasal prongs should be available. Then we have like a basket by the wall side, whereby every other thing that you need is usually there, like the nasal prongs. So all those things has to be there in case seizure occur in the patient, and probably the patient is having a plenty of secretion in the mouth. You could quickly suction the patient. Then also, if the patient is like having low SpO2, you could quickly put up oxygen for that patient. All you are doing is just to make sure the patient is safe. So the seizure precaution is to, like, even if you go into seizure, you don't have to fall and injure yourself, and you don't have to like you have to be monitored, and you don't have to lead to another complication in such situation. And also, what are we doing again? We need to monitor the electrolytes, right? Because there will be electrolyte imbalance in this patient. And I forgot to say this. Sodium, we already said there's hypernatremia. Hypernatremia, sodium is usually inversely proportional to potassium. So if there's hypernatremia, there will be what? There will be hypokalemia. It means that when sodium is up, the potassium will be down. If the potassium is up, the sodium will be down. That is how it works. So for the hypernatremia, you definitely know that it's going to lead towards hyponatremia. So there can be ways in order for us to be able to replace. You can replace the potassium. You can replace the potassium in this patient. And which medication do we use to control this? So we are going to be using desmopressin. So desmopressin can be administered to the patient. So desmopressin actually work like ADH. So what it does is that it helps you with water reabsorption. So once the water is reabsorbed in the body, obviously you are going to start seeing the resolving of the symptoms, such as what? Reducing the urine quantity, like the amount of urine that you are peeing out, then increasing the concentration. Since the urine is going to be reducing, right? So it's going to like be increasing the concentration. At that time, you are not peeing too much again. So the concentration of the urine is going to like get high, and it's going to help you to increase your blood volume as a result of what? As a result of fluid retention, because it's going to help you to reabsorb water back into the body instead of what? Instead of you peeing excessively, it's going to resolve that. So that is what diabetic insipidus is about. So remember, it is when there's hyposecretion of what? Antidiuretic hormone, which is going to lead towards excessive peeing in the patient. So D high, diabetes insipidus. D for what? Dehydration. The patient is going to be dehydrated, and you need to do fluid resuscitation for this patient. Thank you very much. See you in my next video, where we'll be talking about SIADH, which is the opposite of diabetes insipidus. So ensure to follow us on all our social media handle, and we also have an academy whereby we teach Nclex topics, like we teach Nclex curriculum, and we help you to ace your Nclex-Rn examination. Thank you very much, and have a wonderful day. Bye.